Well, very warm welcome, friends, to this webinar, which has the intention of setting out how UNISON is supporting its social care members. We're going to have 3 presentations from UNISON officers, and then we'll be answering questions which you can pose, and I'll tell you how to pose those questions in a moment. Our speakers, first of all, are going to be Christina Mcintyre, our Assistant General Secretary. She'll be followed by Gavin Edwards, the Senior National Officer with particular responsibility for social care. And then he will be followed by Robert Bourne, our National Health and Safety Officer. In order to engage with this, there's a control panel which should be floating around on the right-hand side of your screen in front of you, you out there. And the way to interact with us is to tick in the questions box and then write your question to us in there. So if you could do that, that would be really helpful. If you've got any technical problems, please put them in there and we'll try and connect you. But if you've got questions which you want our panel to answer, that is also the way to do that. And Matt Egan, who's also with us here, National Officer in the Local Government Group, will be going through the questions and posing them to our panel to make sure that they all get asked. So that's the format that we've got. Tap in your questions when you're ready. We'll record this webinar. So and then we'll send it to all of you who've signed up for it. And then you'll be able to watch it again if you want to, or share it with colleagues or whatever you'd like to do. And we'll also follow this up with an email which will contain all of the resources which we talk about today and all of the sort of publications and products that we talk about today to enable all of us to be able to have access to those things once we've finished this today. So if I may now just introduce our first speaker, and that's Christina Mcintyre, our Assistant General Secretary. Christina.
Yeah, thank you. Good evening, and I'll just echo what Andrew said and say thank you very much for joining us. So this is a webinar obviously about social care, and I just wanted to say a few things about what we've been doing in the Union and how important this is. So without doubt, so the social care issue has been the #1 priority for us. It's the issue that we get more questions, more emails, more queries, more comments about it than anything else. More members who work in social care come to us than any other group. And the one thing that I think that has come out of this pandemic is that it's, if nothing else, it has completely destroyed the myth that social care is somehow a low-skill sector. We've shown that that social care is anything but low skilled. It's actually highly skilled. It's just low valued by society, but it's highly skilled. It needs to be properly rewarded, and the staff are doing a fantastic job. And it's obvious when you see the impact, how important social care is, not just to the people who rely on those services, but to across our society. So it's so important to the NHS. It's so important for anyone who's got family who's been looked after by social care, and that's become so obvious as this pandemic has rolled out across the country. So we know that some of the key issues that you've had to deal with, and if you're representing members who work in social care, you've had to deal with the big issues of things like not having access to the right kind of PPE, protective equipment. So we've had huge issues around supply of protective equipment into social care, but we've equally had huge issues around getting good, clear, consistent advice out for this sector. So we've been in, certainly me, Gavin and Matt, that you can see on the screen, are involved in daily contact. At least one of us will be in contact with Department for Health and Social Care, with other government departments, with Public Health England. And I know that colleagues in Scotland, Wales and Northern Ireland are doing exactly the same with the governments and the public health departments in those countries, campaigning, arguing, basically on them every single day about trying to improve the supply of PPE and improve the guidance that's gone out. So one of the issues we've had is that a few weeks ago, Public Health England issued some guidance on PPE in the social care sector. They then updated that, and quite frankly, we've had huge arguments with them about this, because what they saw as updating, we saw as watering down. And they were put under pressure by providers in the sector, who I'm sure many of them didn't do it because they don't want to provide PPE, what they were saying was because of a lack of PPE, they didn't want to be tied into tight guidance. And that's been an issue of huge concern to us. And even today, Gavin has been back to them, pushing them really hard to try and get better guidance out to make it safer in the sector, because we know this is about your safety, but it's also about your family's safety, and critically, it's about the safety of the people that carers look after. So I just wanted to say, you know, we've put a lot of resources into trying to provide as much support as we can. I know Gavin's going to cover that, but one of the things we want to take away from this, and we want to hear from you tonight as well, but one of the things we want to take away from this is that we use this opportunity, the fact that social care has been so prominent in the media, it's, you know, been highlighted everywhere. It's you know, even the Prime Minister has been talking about it. We want to use that as an opportunity to say we need to change things going forward. So we are very clear in Unison that this is an opportunity for us to actually lay out our stall, to make the case for a proper national care service, one that's funded from taxation, free to people who need it, and where we can have a proper pay and grading structure and training structure for the staff who work in the sector. So that's something that we are pushing very hard for, and we will be making sure that basically the sacrifice, the hard work that people have done, you know, the kind of jobs that you and the members you represent have been doing is not forgotten when this pandemic is over. That will be, again, a #1 priority for us. So I'll stop there, Andrew, to let other people come in. Thank you.
Thank you very much, Christina. Now introducing Gavin Edwards, our Senior National Officer for Social Care.
Hi, can people hear me okay? Yeah, okay, all right. Thank you, Andrew, and thanks, Christina. I want to start by saying a massive thank you to everybody listening, whether you're a care worker working in an incredibly difficult situation or a Unison rep or activist working to support our members in social care. Before I begin, it's worth reflecting on the tragedy that care workers are losing their lives as a result of COVID-19. And that would be bad enough, but it is obviously totally unacceptable that so many have been put at greater risk because of lack of PPE, a shambolic testing regime, and also sometimes the behaviour of employers. Today, I'm going to go over the resources available to members in social care, talk a little bit about our engagement with government and politicians, give a bit more detail on that, and then a little bit more detail about what our plans for the coming weeks and months. But to start with, we know that the main issues that have come up during this crisis have been shortages of PPE, unclear guidance on PPE, the testing regime, which has far too often been tailored either to employers or the people who have constructed the regime rather than care workers and the residents of care homes, and also employer behaviour, and particularly the financial pressure that a lot of care workers have been put under in order to attend work against public health guidance because they should be shielding or self-isolating. So first of all, on the resources, there's a dedicated web page for social care specifically on coronavirus, which contains frequently asked questions, signposting to other guidance, including bargaining guidance and model agreements on issues such as leave and furlough. Robert may want to say a little bit more later on about the PPE page and the PPE alerts system. Obviously, with all of these resources that I'm going to mention, we'll put in the notes that get sent out all of the links to this so you can easily find them. There's also a national social care email inbox, and this is something that's constantly monitored. For the emails that are going out on a weekly basis, which I'll talk about in a moment, this is the reply address. So we've been getting literally thousands of emails to it. It's in recognition of the fact that some of our members in care may not know how to get in touch with their branch or their region to assist them. And we have a team of officers who are signposting members to the right place to get help and also to give answers to questions where they're able to do that. We're also logging and monitoring the general issues which are raised so that we can update our frequently asked questions and spot trends and issues as they occur so that we can raise them with ministers and with public health authorities. There's a constant back and forth of communication between national office and regional offices as well over serious issues that are arising. Just this week, we've had issues arising with PPE shortages and unacceptable employer behaviour in Leicester and Sheffield. And on these occasions, we've held meetings with the regional staff online in order to offer support and talk to them about how we can get a good outcome for our members. And that's included liaising with our national press office as well, just because it's sometimes beneficial to shine the light of national media on these situations, because that can concentrate minds. From an early stage, we also recognised it was important to be proactive in reaching out to our members in social care to make sure they know where to get help. So far, since the lockdown began, there have been 5 dedicated social care emails that have gone out. This has included a step-by-step guide on what to do if PPE is a problem in your social care workplace. And there's now an email that's going out every Thursday, which is again showing people where to get help and also giving people all the updates that they need from UNISON. That email is also what we call segmented. So in Scotland, Wales and Northern Ireland, certainly there are different versions of that email which go out, which obviously are tailored to the slightly different circumstances for social care in each of those nations. And also there are some local campaigns that are taking place in regions as well, such as, focused on a particular set of councils, for example, and so we're able to segment the email to suit that as well. So there'll be local as well as national information. While staff in this sector have also seen deaths before this crisis took place, because of the nature of the sector that they work in, many of them will have experienced that. We also recognise that the sheer frequency and distressing nature of deaths in care workplaces due to COVID-19 make this particularly difficult right now, and consequently UNISON has set up a particular part of our website which is dedicated signposting people to resources to support social care members experiencing trauma and bereavement. Again, the link to that will be in the notes following this webinar. UNISON Learning and Organising Services have also commissioned a series of webinars which are about bereavement and dealing with those distressing circumstances. About 2.5 hours long, and we've had, I think, 5 dates already, and we're working on a new set of dates at the moment, and they'll be advertised through the social care email and through our regional networks as well. Colleagues in Northern Ireland have asked me to highlight the last 2 newsletters that they've sent out, particularly the news about the agreement which protects Agenda for Change terms and conditions for members volunteering to work in nursing homes in Northern Ireland. UNISON Northern Ireland have secured guarantees on key issues such as testing and PPE for residents and workers alike. And colleagues in Wales have asked me to highlight the messages that they've been sending out direct to social care members about the Test, Track and Trace programme, which has just been launched in Wales as well. Links to guidance and resources specific to Scotland, Wales and Northern Ireland will be included in all the notes that we send out. So just moving on now to political engagement and the public campaigning that we've been doing. Hopefully many of you will already have seen the campaign PPE Not Promises, which asks members to sign a petition calling for the UK governments to address the emergency over PPE shortages in public services, including social care. And this has helped to support our more targeted engagement, some of which Christina mentioned, such as meetings with ministers, both from Westminster and in devolved administrations. We've emailed every councillor in England and Wales, asking them to use their commissioning role to put pressure on care providers to pay people fairly for the work that they're doing, and making sure that they're not suffering a financial detriment because they're shielding or self-isolating, and also to put pressure on to make sure that PPE is being made available. In Northern Ireland, those services are not commissioned through local authorities, so that's why that email wasn't sent there. And in Scotland, our Scotland office engaged directly with councillors in Scotland. We've been doing a lot of work to push public health authorities, which Christina mentioned, to make sure that their guidance is much clearer. For much of the pandemic, the guidance has been used by some social care employers to justify unsafe practices, such as continuous use of PPE for entire shifts. We're getting some movement on that now, on this, but we're not the only voice in the room trying to influence that, so we're trying to make the case as strongly as possible that what is prioritised is the health and safety of people working in care settings and the people who are receiving care as well. It seems obvious to us that that should be the priority, but sadly that's not always been the case. And there'll be a new version of that guidance coming out soon, which we will have had some influence over, and we're hoping that it will move a little bit further in the right direction. UNISON Press Office, both regionally and nationally, have worked closely with officers working on social care to put as much, it's really important because it puts maximum amount of pressure on politicians and shows our members that we are fighting on their behalf to raise the profile of social care and emphasise its importance as a vital public service. You can go to the UNISON's Media Centre webpage to see all of the social care press releases that have been put out in recent days and weeks, and these have led to large amounts of press coverage and numerous media appearances from UNISON representatives. Working with the Labour Party is also important as well. You may have seen that in his first Prime Minister's questions, Keir Starmer directly quoted a UNISON member who works in a care home telling of their distress and their fear as a result of the shortages of PPE as well, a question that the Prime Minister struggled to answer. Once again, our focus is to make sure that the voice of our members working in social care is the voice that comes to the forefront, and that those views are heard loud and clear by people who have influence and power. So what comes next? Well, the priority now is about PPE and getting people paid fairly if they have to self-isolate or shield, and making sure that the testing regime is radically improved and is tailored to the care workforce rather than the care workforce having to travel unrealistic distances in order to get testing, and that those test results come back quickly. And I know Matt has been doing a huge amount of work engaging with Department of Health and Social Care in order to push them in that direction and seek improvements for our members. But when the pandemic passes, now is the time, as Christina says, to push even harder for the change that has been so desperately needed in social care. We'll be repurposing our Care Workers for Change campaign to ensure that a much wider recognition of the amazing work that care workers do is translated into long-term improvements. And that means pay that reflects the skilled and difficult work that care workers do, proper career paths, and an end to all exploitative practices such as not paying for travel time or sleep-in shifts, and proper sick pay, and a whole range of other issues as well. We know there's more to do, and we know that we as a union might not have got everything right during this period, and we want your feedback. You can give it today or at other times. That's very welcome, because we want to know how we can improve the support that we offer to members in social care. But UNISON is the union of social care, and we're determined to change it for the better. Thanks very much.
Thank you very much, Gavin. I just would encourage you to keep on tapping away with any questions which you might have for any members of our panel, and we'll address them after the remarks from our next speaker, who's Robert Bourne, who is UNISON's Head of Health and Safety. Robert.
Thank you, Andrew. Right, the points I'm going to cover again some of the materials available to you and the issues they cover. I'm going to have give a brief word on the public health guidance out there and how that fits in with employers' responsibilities to conduct risk assessments. And I'm going to finish by talking about perhaps some of the steps we have to take in the way forward from this in developing our organising base, because we strongly believe that the way to guarantee safer workplaces is to have strongly unionised workplaces. The materials we have available, when you go on to the main UNISON site, you will see a link to the main COVID advice and guidance, and that provides information on personal protective equipment, which we know is a huge issue for you, but it also explains how PPE fits in with other measures such as social distancing, isolating and shielding, etc. And also it provides links to the various service group websites, including social care, and the social care site, as Gavin said, has links to all the main guidance you will require, which will tell you in detail the sort of PPE, the level of PPE you require for the situation you're working. Just a few words about public health guidance. As both Christina and Gavin has said, there have been problems with that. The problems have been caused, as said, by employers misleading, I think, of public health authorities on the situation in the workplace. But also, I think there was some confusion out there. I think there was a lack of clarity. I think public health needed to develop a better understanding of what is required in the care home sector and also the home care sector, where I think perhaps their level of expertise and knowledge was not as great as for other sectors. So we've worked hard to improve the guidance. As Christina Gavin said, there has been in many areas there's been what we would call a watering down, the movement to what they term a sessional use of PPE, which means that face masks can be used for more than one user, which we think poses significant risks for transmitting the hazard to service users, and we've raised those issues with public health bodies. There has been also, though, some clarification as to when you are required to use PPE and particularly face masks. Now, this is now recognised that you are required to wear face masks whenever you are within 2 meters of more close contact with a client, regardless of whether they're symptomatic or not. This is a movement from previous guidance, which said it was based on whether the resident or patient was a suspected of having COVID-19, because as many of you pointed out, it is sometimes very difficult to judge whether someone is symptomatic, and at least in that respect, the public health bodies have listened to us. So there has been some improvement there. Just to say how though this also fits very much in with the employer's responsibility to conduct risk assessment, must be emphasised very strongly that the guidance out there does not replace their responsibility to conduct risk assessment. It is there to support it, and they have an overriding legal responsibility to conduct thorough risk assessments. There may also be situations when you, in reality, when you're, which is not foreseen by these risk assessments. These risk assessments should be thorough as possible, but there may be situations which are not foreseen by this assessment, and as part of that, they should be providing training to you on how to provide what is termed a dynamic risk assessment, so you can assess the measures you need to keep both yourself and your residents safe. Just so to finish, I think what I would like to say to finish is that we recognise that the real key to keeping our members safe are people like you out there. It is our activists who keep workplaces safe, and as part of that, we recognise the importance. We even were doing this before the current pandemic, of building up our activist base in social care, and I'm particularly focused, obviously, in improving the number of safety reps we have in social care. And as part of that, we are working with learning and organising services to develop learning modules which are more easily accessible for the sort of settings you're working in. We recognise that you really are at the sharp end, and we also recognise, because it is an area where perhaps we haven't been as well organised as others in the past, you have sometimes difficulty getting time off to attend training. So we're developing training packages, and we're looking at an introductory training package for safety reps, which which doesn't replace the existing package but supplements it, but also looking at the ways of seeing how some of these resources can be provided online, which will again improve the accessibility to this training. So that's really where I'd like to finish, that we recognise the real key to improving the safety of our members are people such as you. Unionised safe workplaces are safer workplaces. Thank you.
Thanks very much, Robert. I'd like now to ask Matt to search through the questions which have been put forward and then put them to our panel, if you would.
Okay, so we've had a number of questions in relation to PPE, so I'll start with a couple of them. So first question from Mark: I'm a senior support worker and we have been told we are to wear face masks for 4 hours and then change. We've had approximately 20 deaths from COVID-19. It's a long story, but this is in part due to hospital discharges of people with the virus. How long do we need to wear these blue masks for?
Right, should I take that? Yep, Gavin and Christina might want to come in. Yes, this comes to the root of some of what Christina and Gavin were talking about when they said about the watering down of guidance. The most recent guidance says that you can use it for more than one user. However, it does say that first of all, a face mask should be replaced at the when you have a natural break in your duties. So that would be a lunch break, if you're fortunate enough to have it, a tea break, etc. But we recognise that that can still be an awful long time wearing a mask. It also says that the mask should be replaced if it becomes soiled or damp. But we're not here to defend that guidance. This is an issue which we've raised concerns about, and we recognise your concerns. And we certainly don't believe that it is good practice to wear a face mask for 8 hours or anything near that time. What I would also say, and this where it comes down to risk assessment, well, whatever the public health guidance says, the employer has a responsibility to both you and the service users to do everything reasonably practical to protect your safety. And if, for example, an inspection was to find that that providers were requiring you to wear face masks which were damaged, soiled for 8 hours, but also, frankly, if they were, I think there would be questions raised as to whether they were in keeping with their underlying health and safety responsibilities. I don't know if Gavin or Christina wants to add anything.
Christina, you want to go?
Yeah, I just wanted to say, I think the important thing here is that there is no fixed time limit on how long it's. So if your employer is saying to you, you have to wear it for 4 hours, that's wrong. It's not what's in the public health. It's not even what's in Public Health England guidance. There is no fixed time on this. That's part of the problem, as in we've had people contacting us telling them employers want to wear it for longer than 4 hours. That's clearly wrong. But the key thing is that you wear it. You can wear it between different patients, because you maybe have seen there's some little films online, some little things that Public Health England have done, which shows how to take them off safely, the risks of taking them on and off. There's also a risk there, as well as keeping them on between patients. So I think the key thing is, your employer can't tell you you must wear it for 4 hours. You wear it until you have a natural break, or you wear it until it's uncomfortable, or it's soiled, or it's damp. And that might happen every 3 or 4 patients. It might happen within an hour, depending on what's happening. So there's no fixed time. That's the message I wanted to get across.
Okay, so 2 more questions on PPE. I'll put them both together. So firstly, from Zoe, I work in supported living. We've been told we only need face masks if the people we are working with present symptoms or have COVID-19. Should we use them as we work very closely with these individuals and also work closely with fellow members of staff. And the second question from Anita, which I think has already been touched upon, is it legal to use the same mask between affected residents all day?
I think, again, I'll answer this, but Christina and Gavin may want to come in. There is some actual inconsistency between some sectors here. The guidance for care homes and for domiciliary care is slightly inconsistent currently with that for supported living. Supported living, it still seems to state that it should be single user at the moment. That's what it says. So that situation with supported living. As to when you're required to, you would obviously you would be required to wear a face mask if you are in close contact with a resident. Again, that we are looking for clarification for public health bodies on this, in that the guidance for supported living has not quite yet kept pace with the changes in the guidance for care homes and home care settings, in that it still has a stipulation for supported living that the person must be suspected of COVID-19, and that. But again, I think it comes back to, and I would expect an employer to be looking at their duties under risk assessment and making sure they're doing everything to protect both you and the people you care for. So I think they should be taking a precautionary approach and providing with face masks whenever you think there's any risk of infection.
Matt, can I just come in on the kind of wider point of the guidance? I think Rob's set out exactly, the current situation. But just to give a bit more detail, we say we're pushing for change. It's exactly these kind of issues that we're pushing on. And I think part of what is happening is that the supply issue is feeding into the guidance issue, and that is wrong, because there have been massive problems with supply of PPE to care homes. The government simply wasn't ready for this. They hadn't prepared. They hadn't put in place the structures and things they needed to put in place so that PPE got to the front line. And then we had the public health guidance at the beginning of this process, which was far from perfect at that time. Then we had the supply issues, and then I think pressure was put on from provider bodies to say, actually, we need to water down the guidance so that we can have people wearing PPE masks for long periods of time. And there's not a single shred of doubt in my mind that has contributed to the issues of COVID-19, both in care homes and in domiciliary care as well. And just to bring you completely up to date, we've been asked to comment on the latest draft at the moment. And one example is in the public domain, so I don't think there's any problem in discussing this. The fact that people who are doing domiciliary care, who are traveling sometimes for long periods of time between visits, are somehow supposed to keep a mask on, not touch it, and it's not going to get damped, it's not going to get soiled somehow during that period. It is absolutely ridiculous, and it has to change, and we're going to put the maximum amount of pressure on for it to change. We shouldn't be in this position now, but we'll have to do everything we can in order to change it.
Okay, so 2 questions on the furloughing scheme from slightly different perspectives. So the first question from Jason is, given the care sector is short of staff, can care providers get away with furloughing staff who are shielding, self-isolating or caring for people at home? Is this not an abuse of the furlough scheme? And from a different perspective, a question from Linda sort of saying that casual staff at my workplace have been told to claim statutory sick pay when they are isolated due to being in the early stages of pregnancy. Is this correct?
Andrew, do you want to come in on that one?
Shall I take the first one?
Yeah, okay.
At least. And that was around, should care providers be able to furlough people given the fact that they actually need to be providing care? And there's quite clear guidance from the government that if a care provider is in receipt of public funds to provide care, they're expected to provide that care, and it's not appropriate to furlough people, except in circumstances where the person needs to be furloughed because they need to shield, or because they are the direct carer of someone who needs to shield. So generally speaking, this isn't a scheme that should be used to furlough people who have a caring responsibility which needs to be carried out, but it is very useful actually in circumstances where we've got people, for example, who are extremely vulnerable, or are having to care for people in their home who are extremely vulnerable, and therefore there would be a risk in their going out and bringing back infection into their own home. So I think that those are the circumstances in which the furlough scheme can be used in care. It's not generally used, but it is useful in those circumstances for sure.
And on the issue of pregnant workers, obviously it's incredibly important that the legal protections that are in place for pregnant workers are respected. And given the situation in care homes and in the care sector at the moment, that's something that should always be in the forefront of employers' minds. So for this particular case, it does sound like something where the details would need to be looked into and make sure that the employer is following the proper guidance. So I'd suggest that if you send us a bit more detail, if you need to, come through to the social care inbox, care@unison.co.uk, give us the details, and then we'll put you in touch with the right people to get it challenged. I think that's probably for those kind of individual cases, getting to know the detail and the circumstances is really important.
Can I just come in quickly there on our COVID-19 advice page? There is advice regarding pregnant workers and situation. My understanding is it's not my area of expertise, so you may want to check this on the site, but that you cannot suffer because of equality legislation, regardless of any government guidance out there, because of equality legislation, you cannot suffer financial detriment through being pregnant.
Okay, next question. Hi, I'm a care worker and we have been told that we can now take the vulnerable people we support out for walks. Can my management force me to do this? Myself and my colleagues do not feel comfortable doing this.
Okay, I'll take that, and others may want to come in if they wish. Again, I think this comes down to a risk assessment really as to what the hazards are specific are. Obviously, the government guidance generally to the public as to when they can go out, that has been changed and relaxed, but that does not necessarily mean that it's always going to be safe to take a resident out. And I cannot really comment on your individual situation and as to what, but it would be down to a risk assessment, and your concerns over the safety for yourself and for your residents should be fed into that risk assessment. Okay.
Yeah, can I come in on that? I just wanted to say, I think Robert's right. It's a clear case about having to get risk assessments for each of these circumstances. So it would depend entirely on how safe you were able to stay when you take the person out. So, what do you need PPE for a start if you're taking someone out? Do you need to socially distance? Is that even possible, depending on what the circumstances are with the person you're going out with? All of those things should be looked at by the employer. They can't just be a blanket decision that from now on you will now take people out for walks until they can reassure you that they've gone through a proper risk assessment, looked at all the different circumstances for those individual clients. So not just a blanket thing across them all. And if you're not happy with it, raise it with your union. And as Gavin's already mentioned, we've got this website, contact us. People are monitoring the questions that we get. You will get a reply. You will get support you need. If your branch can't deal with it, there are people in the regions who will be able to help you with this.
Okay, So we've got 3 very short, sort of more internally focused questions. So firstly from Deborah, what training on the safe uses of PPE can we access to share with UNISON members? Secondly, the social care email that Gavin mentioned, is it sent to both branches and social care members? And thirdly, can UNISON provide a diploma level health and safety course online?
You just come in on the first 2 of those, if that's okay. Others might want to say something about it. So in terms of training on safe use, so Rob will know a little bit more about the kind of internal stuff that we've got. One of the things that we pushed on, in fact, Christina pushed on quite strongly at the start with conversations with Public Health England, was to get kind of little videos produced, guidance videos on the safe use of PPE, because obviously there's huge amounts of documents. It's very difficult to tell quite often which ones are the live documents as opposed to the out-of-date documents, and all very inaccessible on government websites. There needed to be something a lot clearer, and one of those things being training videos, short, easy to understand training videos so people can see what PPE they're supposed to have. Notwithstanding the frustrations that we've got on the PPE guidance, they have now produced those videos and they are available. So that's something that we can link to from our websites as well. Rob, I don't know if you want to say a little bit more about the kind of more internal stuff that we've got in terms of what's on the web pages.
Yeah, first of all, for that, I just want to emphasise though, it's good that public health is, and we're getting public health to provide these videos, but it is really the employer has a legal and overriding legal responsibility to provide training for you on the safe use of PPE. That is an absolute legal requirement, and if they were not to do that, they will be failing with their legal obligations. I just want, as regards the training we have, our training is very much developing our health and safety rep base, and we have a 5-day course on safety rep training, which is currently available, and that is the basic training we provide for all our safety reps. And that is what UNISON provides and is focused on doing, and our emphasis really is on developing this training, but also seeing to other ways we can develop our activist base.
And on the question about the social care email and being copied to branches, it certainly will be from now on. It's something that we've only just put in place, and we're still trying to put in place all the proper procedures around that email. Obviously, things were done at pace as a result of the pandemic. So some service groups may have been sharing it so far with their branches, but we'll make sure that from now on that it is, because obviously it's important that branches see that information as well.
Can I just quickly talk as well about the training? What we're also looking to do, because this is going to be one of the critical things, is about not just for the social care sector but across, is about returning to work, is we're going to actually produce some short training, online training on risk assessments, which I hope people will find helpful. So that should be available soon. Probably within the next week or so we'll have something ready on a short, sharp, just a quick training session on risk assessments.
So actually, the next question follows on quite neatly from that. It's a question from Situ about Black members. Can you provide any information about risk assessments for Black and minority ethnic care workers, given that many people are worried about the increased level of deaths amongst this group of workers?
I'll take that initially. Yes,
about what you might be involved in this, about stuff that's happening in the health set. Are you involved in the health service work on this?
No, you may be able to fill in on a little bit on that.
I'll just mention what's happening that I know of in the health service. So I know that our staff who do the negotiations in the health service are having discussions with the NHS on specific risk assessments for Black and ethnic minority staff, and I think for staff with other protected characteristics. But initially they're looking very specifically at risk assessments for this group of staff, and we're involved in the discussions around this. it's not finished yet. The work is still ongoing. And I think our push is to try and make it as clear as possible, but also we would want to get that extended into the care sector as well. And I think a lot of the risk assessments that we're talking about would also be very relevant in the care sector. So at this point, it's kind of watch this space. Again, it's such a fast moving environment at the moment that when I say it's being developed, by that I mean it should be ready in days. It's not weeks and weeks, because we can't wait that long, because this information and advice is needed straight away.
Okay, I'll just add to that yeah, so you've raised a very valid point, and the employer has a duty, both under health and safety law, to consider the added risk which has been identified for black ethnic minorities in their risk assessment. So that would be covered by health and safety law. But they also have certain duties under equality law to ensure that they're not be discriminated against, and there would be an equality element to the risk assessment as well. So there are two very good legal reasons why the employer should be considering that in their risk assessment.
Okay, thank you. Next question from a care worker who says, we are being asked to take holiday still, even if we currently don't want to use it, as there's obviously a requirement for lots of staff to keep on working at the minute. Can my employer make me take holiday at this time?
Should I take that one? Yeah, so employers can, generally speaking, require that leave be taken at particular times. But this is something where you want to speak to your branch and see whether it's within the confines of those rules which are set out. But it is possible for employers to require that leave be taken at particular times. So that's the general answer. But the particular answer is, in your own circumstances, speak with your branch and get advice on whether in these circumstances it's actually legal for them to require you to do this.
Right, thank you. And a question from a member who works as a cleaner in a care home. So there are sort of two separate questions. As a cleaner, what should you do if there's no PPE to carry out your job? And am I safe in doing my duty working in the room of a resident who has COVID-19 when they are present?
I'll take that. There is advice on cleaning in what's called non-healthcare settings, and I believe that would cover social care settings. It doesn't, to be honest, that guidance out there does not deal with the situation you've raised where the person is resident. What it does say is very specifically that if you're working in a place where there's a high level of COVID-19 contamination, as well as gloves and aprons, you may be required to wear a face mask, and even in some cases eye protection if there is a risk of splashing. In the situation you've raised, then that could well be covered by that situation, although it doesn't specifically mention it. You've covered, I think, a situation. Again, this is where it comes down to basic risk assessment, and the risk assessment would indicate that there's a high. I could not say it categorically because it depends on the exact circumstance, but a risk assessment to me would indicate that some form of facial protection may be required.
Okay, a question from Olive in relation to could care staff be subject to temperature tests at the start of every shift in order to help try and limit the spread of the virus?
So I have heard examples of that happening. It's clearly, an attempt to limit the risk of exposure to COVID within a particular setting. What isn't acceptable is people having those tests done, being refused admission to work, and then being told that they're not going to get paid properly, or they're not going to be, they suffer a financial detriment as a result of having a high temperature on a particular day. And I've seen a case come into the social care inbox only today, which is essentially that's what's been happening. If that's what's happening in this case, then get in touch with us, and I think we'll get some support for you and get some assistance in challenging if that's what is going on. Rob might know a little bit more about the kind of technicalities of temperature tests and those kind of things.
The only thing I can add there is, from my understanding, there is no legal requirement on employers to carry out temperature testing. Obviously, what UNISON has been pushing for is that there should be proper tracing and testing for all care workers, which is really the way of deciding whether someone is COVID-19 positive, because obviously there are going to be problems with a temperature test. And as Gavin has said, the important thing is they should suffer no financial detriment for if they are prevented from working because of a temperature test introduced by employers.
Okay, great. So very practical. Yeah, sorry, Christina.
On this one, I think it seems a bit rich, given that we weren't testing people coming into the country from abroad. We haven't had a policy of taking temperatures anywhere. I think if an employer wanted to bring in a blanket approach to this, at the very least, we would expect them to talk to the union or talk to the staff involved, and if the staff were happy with it. But if they're not happy with it, and you'd have to, as Gavin said, go through all the potential consequences of what would happen if somebody did test as having a high temperature. So, what are they planning to do with the information if they got it? I don't see it becoming widespread. I mean, I could be wrong about this, but you were asking, do we think this is something that will come in? At this point in time, it doesn't look like it, but as I said earlier, it's very fast moving at the moment, and government advice, clinical advice, medical advice, it seems to be changing all the time on this.
It might be worth, Matt, as you hear, you're hearing a lot of the latest updates about the testing regime. It might be, off the back of that question, it might be an idea just to say a little bit about how you see the testing regime rolling out a little bit.
Yeah, so I attend a number of meetings in relation to the testing program across England. Unfortunately, the ambition of the testing program seems to be focused primarily on testing care home workers and residents, and not testing them on a regular basis, which is what we'd want to see. But there's no real mention of workers who are based in supported living premises or work in the home care sector. So we've not actually had the issue of temperature testing raised as of yet. And as Gavin touched upon at the start of the talk, unfortunately there are sort of a lot of problems with this sort of overarching approach to testing in the sector.
I just wanted to come in before we move on to because Christina made a good point about consulting with the union, and I would just had to add there is actual legal requirement on employers to consult with safety reps on any changes to which affect the health and safety of their members, and I think testing of any sort will come into that, so they should be consulting with your safety reps on that.
A question from Samantha. What should you do if you've been working with a member of staff who has COVID symptoms, but your employer hasn't bothered to tell you about the potential exposure? Do they have a duty to tell other staff that colleagues might have COVID-19 symptoms?
You go, Rob.
I'll try on this one. What they have a duty to do is to do everything that is reasonably practical to protect your safety. As far as I'm aware, if somebody has COVID-19 symptoms and they have been in work, and I would they basically would have a duty to ensure that the appropriate measures are required to meet with the government guidelines regarding the periods of quarantine, etc., which all sure you're aware of. If you've shared a space with somebody, if you are being resident with somebody who is COVID-19 positive. I don't know if Gavin wants to come in on that.
I think you're right, Rob. Just thinking it through, it's implicit in the public health guidance, isn't it, that they would need, because the guidance specifies different situations and different PPEs based on whether or not somebody's symptomatic or non-symptomatic. Well, it follows that nobody could possibly do that unless they knew the status of that person, and so it's implicit in the guidance. It may be somewhere else in other guidance, it may be explicit, but it's implicit in the guidance that I've seen that they would need to tell you, otherwise you couldn't follow the guidance.
Yeah, what is explicit is when they conduct a risk assessment, they should be taking into all those factors in consideration, and they should be making you aware of those. So they have wider health and safety responsibilities beyond the guidance, which is absolutely mandatory.
Because there's legislation, there's guidance, very clear guidance on self-isolation as well. Once you've been at risk, so that you're not passing it on to other people and the client group that you're caring for.
Right. So if I finish off with two questions, one from Stephen and one from Linda. So Linda asks, can UNISON put the risk assessment templates online and let us know how we're thinking for the risk assessment training? And on a different topic from Stephen, is there any point in testing workers who are not symptomatic if the tests don't work unless you are symptomatic?
So I'm happy to say that my understanding is the tests work whether you're symptomatic or not. There is quite a high negative positive. So there's a lot of, what do they call them, negative positives coming through. So you would come back as, it might say you're negative, but actually there's a high error rate apparently in the testing at the moment. So it's not a particularly good test, but it's the only one we've got, so they're going through with it. So no, it works whether you're symptomatic or not. Sorry, what was the other point? The other question there was
template, the risk assessment.
Oh, yeah. Once we've got that, as I said, that should be happening very soon. I'm looking at Robert here. We will definitely be able, we'll put guidance online to tell people where to go to get it.
It's a piece of work I'm working on at the moment, developing a generic template for risk assessment, and then we're looking to see also how we can provide set specific templates for risk assessment, and obviously social care will be a very high priority on that.
And we're also going to be training regional staff, so the union staff will also be getting trained on this, so that it won't all be down to branches or individual representatives. We should have staff able to go out to be able to work with employers as well to help with risk assessments, you know, to actually get back to employers with some detailed issues around risk assessments, and this, what we should be asking for, what employers should be doing in risk assessments.
So look, colleagues, thanks very much. We've wound our way round to 8 o'clock, and I think we've had some really interesting questions. So thank you very much for asking those. Just before you go, because we're about to close down, would you like to just write in the questions box whether you found this useful, what you would have liked to see that you didn't see, what else you would like to see in terms of us providing information, so that we can better understand what it is that would be most useful to you. So please just write in whether you liked it or you didn't like it, what was good about it, what could be improved, because that's the way that we can make sure that this will be better if we do it again. And we're more than happy to do it again when we have more things to say. So let's think of having more gatherings like this. Thank you very much for taking part. It's been nice to spend an evening with you guys, and good night.
Thank you. Good night. Thank you.